So adrenal fatigue, we're talking about the blood pressure going down on standing and the pulse going up 10 to 15 points also on standing. When one looks at the eyes, they have a peculiar type of contraction when light is put into the pupil. Normally, the pupil contracts and stays contracted 15 to 20 seconds. But with adrenal fatigue, within a matter of a few seconds, it starts dilating. Sometimes it contracts again and dilates. We also note that if with a pin a line is drawn on the skin, in most people that are normal, it turns pink within 60 seconds. But with adrenal fatigue, it remains white longer, discovered by an Emile Sargent, referred to as Sargent's, or in this country, Sargent's line. There's also tenderness when one hits the adrenal. More than that, the reflexes are markedly elevated. The deep tendon reflexes in the lower extremity. On the upper extremity, they are not. One could do a test, and it's usually a 24-hour cortisol test with the DHEA obtained twice during that time. We do a 8 a.m., a noon, a 4 p.m., and if possible, a midnight cortisol. We do this with a salivette where the saliva is sent off to the laboratory and they analyze the cortisol levels and the DHEA. Normally, as mentioned, the cortisol is high in the morning, low in the evening. But in these folks, the cortisol is low throughout the day or there's an evening spike. And the DHEA, which is also a reflection of the activity of the adrenal gland, is usually lower. The treatment, of which there are many ways to treat, naturopathic doctors use glandulars. They also use magnesium, selenium, high-dose B vitamins, ashwagandha. However, I treat this with bioidentical adrenal hormone, hydrocortisone, 20 milligrams in the morning and half that dose in the afternoon before they're scheduled to crash. It is inexpensive, and if you look up the side effects of hydrocortisone, they're tremendous, but this is a physiologic dose, no side effects. Again, 1 in the morning, half before they're going to crash. And if they are low in their other hormones, the sex hormones such as testosterone, estrogen, progesterone, I replenish those. Adrenal fatigue, 2012.